Welcome. We begin with what I call the landscape. Right now, our profession is experiencing rapid digital change. Technology is no longer a future concept. It is present in our classrooms, it is embedded in our hospitals, it is influencing how care is delivered every single day. And when change happens at this pace, uncertainty is natural. Some of us feel curious, some feel overwhelmed, some feel concerned about what this means for our identity as nurses. The reaction is human. So, in this first section, our goal is simple. We will build a shared understanding. We will move from anxiety to clarity. Instead of viewing these systems as mysterious or threatening, we will learn to see them as what they truly are: tools, powerful tools. Tools that require our knowledge, our judgment, and our ethical leadership. Technology does not replace nursing. Again, technology does not replace nursing. It depends on nursing. And today, we begin by learning the language that allows us not just to adapt, but to lead. Let's talk openly about the anxiety around artificial intelligence. Many nurses describe AI as a black box, something that produces an answer, but does not explain how it got there. When the reasoning feels hidden, it can create discomfort. It can feel like our clinical judgment is being pushed aside. That reaction makes sense. But our goal is to move towards what I call a glass box mindset. Instead of fearing what we cannot see, we learn to understand how the system works. We examine the inputs, we question the outputs, we stay engaged in the reasoning process. When we understand the data going in, we are better equipped to understand what comes out. And that is the shift from reactive fear to informed decision discerning adoption. Artificial intelligence should never replace clinical reasoning. It should invite it. When we can see inside the box, we can govern it. If we're going to govern these tools, we first have to define them clearly. Not everything that uses a computer is artificial intelligence. There is a difference. Let's define our terms clearly. Look at the image on the screen. On one side, you see a train. On the other side, a flock of birds. The train represents automation. A train runs on fixed tracks. It follows a predetermined path. It stops at scheduled stations. It does exactly what it was programmed to do. That's automation. It is reliable, it's predictable, but it does not adapt unless someone changes the track. Now look at the flock of birds. There's no single track, no visible leader. Each bird adjusts in real time based on the movement of the others. That is artificial intelligence. AI analyzes patterns. It responds to changing conditions. It learns from data. It adapts. In nursing terms, automation is like a calculator or a basic medication reminders, fixed and rule-based. Artificial intelligence is like a sepsis risk score in an electronic health record. It analyzes trends across thousands of patients and predicts what might happen next. The train follows rules, the flock responds to patterns. Automation executes, artificial intelligence anticipates. And that distinction matters because you manage a train differently than you manage a living, adapting system. Now let's address one of the biggest fears directly. The idea that artificial intelligence will replace nurses. That fear is understandable, but it is not supported by evidence. Professional organizations, including the American Nurses Association, are clear about this. Artificial intelligence is meant to support nursing practice, not replace it. Here's why. An algorithm can process millions of data points in seconds, but it cannot sit at the bedside and make sense that something feels off. It cannot read a family's anxiety. It cannot understand culture, values, or suffering. And it cannot carry moral responsibility. Artificial intelligence can analyze patterns, but it cannot care. AI handles data processing, it organizes information, it flags risk, and when it does that well, it frees us. It gives us more space for the work that defines nursing: critical thinking, clinical judgment, advocacy, communication, and human connection. Technology does not replace nurses. It removes lower level tasks so we can practice at the top of our profession. Let's make this concrete. Across many healthcare systems, artificial intelligence is now being integrated into five major areas of nursing practice. First, patient deterioration. Predictive vitals and wearable biosensors are analyzing patterns in heart rate, respiratory rate, oxygen levels, and other data points. Some systems can predict clinical decline many hours before a visible event occurs. That means earlier awareness, earlier intervention. Second, sepsis alerting. Early warning systems now use tiered alerting models. Instead of looking at just few criteria, they analyze hundreds of variables at once to generate a risk score. Third, documentation. Generative text tools and ambient listening systems are beginning to assist with note drafting. The nurse shifts from typing every word to reviewing, verifying, and refining what the system generates. Fourth, staffing. Acuity model algorithm forecasts patient census and estimate workforce needs. These systems influence how assignments are built and how units are staffed. Fifth, throughput. Discharge prediction tools and closed-loop bed management systems help anticipate when beds will open and how patients move through the hospital. Notice something important. These systems are not futuristic robots. They are embedded in everyday workflows. They look like alerts, dashboards, documentation tools, staffing grids. Artificial intelligence in nursing is not a future concept. It is part of the system you're already working in. Let's make this visual. On the left side of the slide, you see the machine role. The machine handles the science of data. It processes information at incredible speed. It recognizes patterns across thousands of patients. It calculates probabilities. It detects trends that the human eye might miss. That is what machines are built to do. Now look at the right side, the nurse's role. The nurse handles the art of care. We interpret meaning, we consider ethics, we understand family dynamics and culture, we assess pain, fear, confusion, and comfort. We perform complex physical care that requires skill and touch. The machine can recognize patterns, but it cannot understand suffering. The machine can calculate risk, but it cannot carry responsibility. This is not a replacement. This is augmentation. Artificial intelligence handles the speed and the science. Nursing provides the wisdom and the context. And when those two work together, patient safety improves. Now we arrive at the heart of this transformation. If artificial intelligence is entering nursing practice, the most important question becomes, where do we stand in the process? Let's walk through what you are seeing on the screen. This process begins with data input, their vital signs, lab values, documentation, monitoring streams. That data then moves into AI prediction. The system analyzes patterns, it calculates risk, it generates a probability. But notice something very important. The process does not end there. It moves to the nurse, the validator. That is the human in the loop. The algorithm produces a prediction, you interpret it, you compare it to the patient in front of you, you decide what it means, and only then does it move to patient care. That sequence matters. Data does not care for patients. Predictions do not care for patients. Nurses do. Now look at the box at the bottom of the slide. This is what I call algorithmovigilance. Just like we monitor medication for adverse effects, we must monitor algorithms for errors. Being the human in the loop comes with three clear responsibilities. First, validate. If the system gives a risk score, pause and compare it to what you're seeing. If the system says high risk, but your patient's still talking comfortably and stable, ask why. If the screen says low risk, but something feels off, trust that instinct and investigate. Validations means this. Does the data match the patient in front of me? Second, verify. Some AI systems can generate summaries or draft notes. They may sound polished and confident, but confident does not always mean correct. Always read carefully, check the facts. Make sure what is written truly reflects your assessment. Remember, your name is on that documentation. Your signature carries legal and ethical responsibility. Third, mitigate bias. Algorithms learn from past data. If healthcare has historically treated some populations differently, that bias can show up in the system. For example, certain conditions may present differently in different skin tones. Language barriers may affect documentation patterns. As nurses, we advocate for vulnerable patients. That means asking, is this system working fairly for everyone? Could this patient be overlooked? Artificial intelligence can calculate risk, but only nurses can protect people. This is clinical humanism in the digital age. Artificial intelligence can calculate, but use safeguard. That is the human in the loop. Before we move forward, let's pause, because this is more than a knowledge check. It's a mindset check. In a world where technology is becoming more intelligent, what becomes more important, not less, is human judgment. Which statement best describes the role of artificial intelligence in nursing leadership practice? A. Artificial intelligence replaces nursing judgment to improve efficiency. B. Artificial intelligence eliminates the need for clinical accountability. C. Artificial intelligence augments nursing judgment while increasing professional responsibility. D. Artificial intelligence functions independently of nursing leadership. The correct answer is C. Artificial intelligence augments nursing judgment while increasing professional responsibility. Notice the language, increasing responsibility. Artificial intelligence does not reduce your role, it expands it. The machine can process data at incredible speed, but it cannot understand suffering. It cannot weigh values. It cannot take ethical responsibility. That belongs to you, the nurse. The algorithm gives a probability. You, the nurse, give meaning. The system generates risk. You, the nurse, decide what matters. As technology becomes more advanced, the need for emotionally intelligent, ethically grounded nurses becomes even greater. Because no system, no matter how sophisticated, can replace moral agency. And that is the heart of nursing. Not replacing machines, leading them.